Have you noticed something different about your cat lately? Maybe they're quieter, sleeping more, eating less, and you tell yourself, it's probably nothing. But what if those small changes are actually signs? Cats are masters at hiding pain, and by the time it becomes obvious, it can be too late. In this video, I'll show you 10 warning signs that every cat owner should never ignore. Before it's too late, here are 10 signs your cat needs help. Watch closely and act fast. Now, listen up. Your cat lives in a world that's fundamentally different from ours. They are masters of disguise, hiding their pain, their fear, their sickness. It's a survival instinct, honed over thousands of years, when showing weakness meant becoming dinner. But at home, that instinct can be a double-edged sword. When they finally show a sign, you have to believe them. It may already be more serious than you think. This isn't paranoia. It's responsible guardianship. We'll decode the subtle and not-so-subtle language of feline distress. This is your Vet Alert Countdown. Think of me as your translator, your guide into the mind of your cat. We look at the whole cat, their mojo. When it's off, their universe tilts. What to watch for, why it matters, and when to call your vet, so you can act with confidence. Beat. All right, let's talk about the food bowl. When a chowhound turns away, it's not pickiness, it's a siren. Refusing food for more than a day, 2 at the absolute most, is a massive red flag. Ignoring even favorite treats, that screams something is wrong inside me. Causes range from dental pain, broken teeth, inflamed gums, to internal disease, kidney issues, pancreatitis, GI blockages, even cancer. Ignoring it is like ignoring smoke from your car hood. You pull over now. For cats, not eating risks fatty liver disease. It can develop in days and be fatal without treatment. Call your vet. Be ready. How long not eating? Drinking, vomiting, lethargy, hiding. Every detail helps. Exams, blood panels, x-rays, ultrasounds find the root and start treatment. They'll look for dental disease, abscesses, foreign objects, and abdominal pain. This teamwork, your vigilance, their expertise, gets your cat's mojo back. If the dinner bell rings and your cat's a no-show for 24 hours, answer the cry for help. Cats sleep a lot, but there's a big difference between a sunbeam nap and a ghost in your home. Extreme lethargy, not just tired, but a profound lack of energy and engagement. Paired with hiding, it's a primal response. Sick or pained cats seek solitude. If you're hunting for them or they emerge briefly, then vanish. Pay attention. Judge by their baseline. A social Velcro cat becoming distant signals trouble. They may be managing discomfort, pain, or illness in the only way they know. Be a detective. Note spots, duration, gait, eating, drinking, litter box use. Causes range from infection, fever, kidney heart disease to anxiety and pain like arthritis. Your vet's exam plus blood tests reveal infection, anemia, organ function, the check engine light. Early diagnosis leads to treatment, medications, diet, pain management, and better outcomes. Don't underestimate a cat in retreat. Get professional help. Bring them back into the light with a vet visit. Noticeable, rapid weight loss is a neon billboard. Something is wrong. Feel a long spine and ribs. More prominent bones. Time to act. Cats hide weakness. If weight is dropping fast, it's overriding their instinct to mask. A pound lost on a 10-pound cat is 10%. That's a 150-pound person losing 15 pounds. Common culprits: hypothyroidism, diabetes, IBD, kidney disease, cancer. You can't be in denial. Call your vet. Be ready. When did it start? Appetite, thirst, litter box, activity? Exam, palpation, stethoscope, gum, colour, eyes, coat, temperature, accurate weight, baseline. CBC, chemistry, thyroid, T4, urinalysis, build a full picture. Organs, infection, anemia. Results confirm or rule out, guiding a targeted treatment plan. This isn't just stopping weight loss, it's restoring quality of life. Be your cat's advocate. Get their confidence back. Changes in breathing are drop. Everything emergencies: rapid, shallow, open-mouth breathing, panting. Dogs pant. Cats don't. Panting cats are in distress. Exaggerated movement or abdominal effort. Laboured breathing. Listen: wheezing, coughing, crackles, whistling. Neck stretched, elbows splayed, opening airways. Crisis: heart disease, asthma, pneumonia, pleural effusion, trauma, foreign object, all life-threatening. Call en route. Oxygen and emergency gear, ready shaves, critical minutes. Stabilize, then chest x-rays, T-fast ultrasound, medications like diuretics or bronchodilators. Move slowly, keep calm, minimize stress, get to the vet now. Immediate intervention can be the difference between life and death. You got them there. You gave them a fighting chance. Cats spend huge chunks of wake time grooming, up to 50%. Healthy cat, clean coat. If grooming slows or stops, dull, greasy, scruffy fur, dandruff, spiky separation, red flags. Mats are painful, trap moisture, dirt or bacteria, can cause infection and restrict movement. Pain is common. Arthritis in spine, hips makes reaching lower back base of tail excruciating. Dental disease means using the mouth to groom hurts. Instinct loses to pain. Systemic illness, e.g. kidney disease, causes nausea, mouth ulcers, low energy, grooming drops. Obesity reduces flexibility, ungroomed back, hind end, tail. Hygiene and mats follow. See your vet. Diagnose pain, illness, and manage it. Coat improves when cause is treated. Meanwhile, assist, daily gentle brushing, prevent mats. Never cut mats. Skin is easily injured. Severe mats need a professional groomer or vet with clippers. Help their coat while treating the cause. Comfort returns, mojo follows. Be their groomer, their advocate. When a cuddle bug turns cold, the social thermometer drops. Something is off. Avoiding touch isn't rejection, it's a symptom. Any drastic change from their norm is a major red flag. Irritable, hissy, cranky, often pain. They're defending sore areas. If pain is ruled out, look to environment. Change triggers anxiety, aggression, fear, or clinginess. Investigate context. When, where, touched area, eating, drinking, litter habits. Rule out physical causes. Trip to the vet is non-negotiable. Then modify environment. Safe spaces, vertical territory, predictable routine, sweet to spicy, aloof to clingy. Sudden switches are data, not drama. Don't take it personally. Get curious. It's not a mood swing. It's a message. Listen. Document. Call your vet. Cats are vertical athletes. Hesitation and avoidance are pain whispers. A limp is obvious and always pain. Reluctance to run or pounce isn't laziness. It's calculated pain avoidance. When jumping, climbing, running fade, their world shrinks and confidence crumbles. Common culprit? Arthritis. Not just age, disease causing inflammation and pain. Analyze movement, stiffness after naps, bunny hopping stairs, skipping favourite high spots, wobbly, staggering, drunken gait. Possible neurological issue, true emergency. From limb injury to brain-body miscommunication, infection, tumour, stroke, poisoning. Do not wait and see. Describe which leg, wobble type, onset time to your vet. Their confident navigation depends on pain-free movement. We step in fast. Treatment restores altitude and attitude. Be their first responder. Occasional hairballs happen. Repeated vomiting within 24 hours. Major red flag. Vomiting drains fluids, electrolytes, fast tracks dehydration and kidney strain. Record type, food, bile, foam, frequency, any blood, whether they eat, drink between episodes. Causes range from GI blockage to pancreatitis, IBD, kidney liver disease, some cancers. They need medical help to stop the purge and treat the cause. Diarrhea over 24-48 hours is serious. Intestines aren't absorbing water, nutrients. Potential causes: Giardia, coccidia, bacterial or viral infections, IBD, food allergies, stress colitis. Note straining, frequency, mucus, black tarry, upper GI versus bright red blood, lower GI. Persistent GI upset spirals quickly. Don't self-medicate. Human meds can be toxic. Call your vet. Diagnostics guide care. Your fast action halts the decline. Your cat's gut is asking for help. Answer now. Get them seen today. Water matters, but obsession with the bowl is a quiet alarm bell. Excessive thirst, polydipsia, and urination, polyuria, go hand in hand. Suddenly massive clumps, multiple daily scoops. It's physiology, not behavior. Two big culprits: kidney disease and diabetes. Kidneys can't concentrate urine, dehydration drives thirst. With diabetes, high sugar spills into urine and drags water with it. Relentless drinking follows. Scooping isn't a chore, it's diagnostics. Volume, frequency, saturation are headlines. Accidents from urgency aren't misbehavior. Don't punish, investigate. Other causes: hypothyroidism, liver disease, some infections, cancers, needs testing. Blood work and urinalysis check kidney values, glucose, and markers to pinpoint cause. Don't ignore the alarm before smoke shows. This is early warning. Pick up the phone, tell your vet what you're seeing, go now. This call changes their future health. Sudden temperament change, hissing, swatting, hiding, is often pain speaking. When a spot hurts, they anticipate pain and put up a wall. Common sources: dental disease, arthritis, urinary tract issues. It's self-preservation, not betrayal. Sudden increase in meowing or deep night yowls signal pain, confusion, or anxiety. Older cats may have cognitive dysfunction, disorientation, and vocalizing to find you. Hypothyroidism or high blood pressure can drive non-stop vocalization. Record the sound, note the times, gold for your vet. Aggression or yowling is a symptom. Diagnostics reveal the cause. Compassion guides response. Respond with empathy, observation, and a prompt call to the vet. Treat the pain, the voice quiets. you listen to their language. We've covered 10 critical signs. Your cat's language of distress, from food and litter to how they move and sound, vital information. They can't call the doctor. They show you with behavior. They're counting on you to notice. Our promise: be their advocate, protector, and interpreter. Early detection of kidney disease, diabetes, hypothyroidism, arthritis changes outcomes and lives. Turn scooping into a health check, petting into a gentle exam. Watch eating, drinking, play, rest. Know they're normal so you can spot abnormal fast. Trust your gut. If something feels off, don't wait and see. Call your veterinarian right away. Your vigilance plus their expertise is your cat's best defense. Now, give your cat a quick checkup and subscribe for more ways to give them their best 9 lives. Your cat is counting on you. Don't let them down.